everybody. Good afternoon. Thanks for coming to our presentation of the demos of the winners of our challenges in home and community-based services and social determinants of health. Yesterday, we had a really fantastic live pitch, and I want to extend my congratulations to all 6 finalists. But today, we're going to see demos from the 2 winners, the winners in each category. And I'll introduce the first team, and then they'll come and give a brief demo. And this is the winner of the home and community-based services category of our challenge, and the company is called Ooney, and we have with us today Sean Baumgartner and Emily Finlayson, who are going to demonstrate, and I'll just tell you a little bit about them. Emily is a colorectal surgeon at UCSF who realized that her patients weren't recovering, not because of what happened in surgery, but because of what didn't happen before. The result is PrehabPal, a home-based web app for older adults which delivers individualized prehabilitation to accelerate postoperative functional recovery and return to independence after surgery. And now Sean and Emily will come out and demo.
Great. Thanks so much, Kathy, and thank you, Robert Wood Johnson Foundation and Health 2.0. We're really happy to be here today. We're going to take you through a presentation about our product, PrehabPal. Our company is Ooney. And if you'd like to see a live demo, please come by and visit us today. We'll be here in the Hive.
So every year in the United States, over 4 million older adults undergo a major high-risk operation. So nearly 50% of all major high-risk surgeries are performed in this population. And we know that as patients age, the risk of having devastating complications increases exponentially. So recent studies have shown that prehabilitation, targeted preparation before surgery, can reduce complications, decrease length of hospital stay, decrease your likelihood of having to go to a skilled nursing facility, and allow you to recover faster. So what is prehabilitation? Simply put, it's a targeted, individualized program around diet and exercise, but also around getting your home prepared, getting all your ducks in a row before surgery, making sure you have all the support in advance. And based on recent studies, just based on length of stay reduction alone, if a hospital can implement prehabilitation, you could save at least up to $2 million per year. The key problem is that although surgeons and hospitals are very eager to implement prehabilitation, and it has a lot of face validity, there's a real challenge in how to deliver this service because it happens in the home. So the patient sees the surgeon, makes the plan for surgery, and has to go home and have this targeted plan and stay engaged in this period before the elective surgery.
So PrehabPal has 2 main parts. The first is an assessment that the patient takes either in the clinic or at home, and this 47-question survey creates an individualized plan for that patient. The next day at home, they get an email reminder. In fact, they get an email every single day reminding them to engage with the application. They complete 4 tasks in 4 categories that help them prepare for surgery. We also have health coaches. You can see here, Vicky, our health coach, engages with this patient, preparing them for surgery. If there's ever an issue or a question, Vicky can contact the patient via in-app secure chat or over the phone. Thank you so much.
Thanks.
Okay. That was great. Thank you, Emily and Sean. And now I'm going to introduce the other team. The other category that we had in our challenge this year was social determinants of health. And I would say that in the many years that we've been doing challenges with Health 2.0, now Catalyst, this was a year when we had the most completed applications, approximately 100 in each category. So there's a tremendous amount of interest in these 2 areas, and I think a lot of opportunity too. So in the social determinants of health category, our winner is the Social Impact AI Lab of New York. And with us today, we're going to have Marty Ilisco and Besa Bauta. And I'll read a little bit about this to you. The Social Impact AI Lab is a consortium of 3 of the largest nonprofit social service agencies in New York. So it's Mercy First, the New York Foundling, and SDoH Families of Services, and the technology company Augmented Intelligence. And the consortium was formed to research and develop artificial intelligence solutions for agencies that care for vulnerable youth and families in child welfare. And so here comes Marty and Besa. Thank you.
Hello, everyone.
Hi.
I'm Besa Bauta, Chief Data Officer for Mercy First.
Marty Ilisco, CEO of Augmented Intelligence.
Social Impact's AI Lab goal is to ensure that we care for our children and families, as well as to get the most value and data in order to provide care for our families. Everyone here at some point in time has come in contact with social services. We provide the greatest return on investment, however, least likely to benefit from technological innovations. Our goal is to work with our partners to ensure that we extract the most valuable data from our city and state systems in order to tailor care for our children and families. In order to do that, we're working with different partners, as we mentioned before, to pull data from different systems. So Marty will demonstrate the application in action.
Sure. So on the screen are several pages from a 100-page case file for a family we'll call the Dobsons. As a caseworker, you would spend several hours reading through this case file and learn that Miss Dobson, the mother, has a history of drug and mental health issues, and her 2 children are currently living with a foster family. You'd also learn the services she's receiving so that she can regain custody of her children, as well as the social determinants of health that are impacting the likelihood of that occurring. Now imagine doing this for 15 to 30 other families that you care for. You'd get at best a cursory understanding of those SDoH factors and be left with very little time to spend with the family. Our product utilizes AI to identify those SDoH factors that are buried deep in the case notes, and this is where the majority of that data resides. So to begin, I'll first search for the Dobson family. Our application takes a second or two to process the notes. And then on the screen, you're presented with a single-page view of a concise history of that client, child, or family. On the left, we're identifying events where relevant SDoH data is described. If you scroll down to, let's say, May 5th, you'd know that Ms. Dobson was experiencing housing stability issues, a key SDoH factor. On the right, we are assessing risk over time. If it spikes, you should understand that there's an issue that should be addressed. And on the bottom, we're assessing social connectedness, or how well that person is integrated in their community. If a person has very few people that they interact with, well, that's an issue that should be addressed. What's going on beneath the surface is the application of natural language processing. And AI systems are trained to understand context by feeding it raw data. We train our systems to understand child welfare context by feeding it millions of progress notes provided by our partners. And then when a new case like the Dobsons comes in, our system knows what to look for, particularly SDoH factors, and presents it succinctly to the caseworker to help her do her job and care better for the family. Thank you.
Thank you.
Thank you very much, Marty and Besa. And that's it. Thank you very much, guys. And we'll be back next year with another challenge round.